Welcome to the Attention Deficit Disorder Expert Podcast Series by Attitude Magazine.
Hey everyone, good afternoon. It's Susan Coffin here for Attitude's weekly ADHD Experts broadcast. Welcome. Today we'll be talking to Dr. Thomas Brown about how to best diagnose attention deficit disorder. Many of us have been told that an accurate ADHD diagnosis requires a full battery of neuropsychological testing, even brain imaging, and or computerized tests to measure attention. Dr. Brown, who will be talking to us today, disagrees, and he'll tell us how families can save time and money and get more accurate testing by knowing which tests are valuable to assess the symptoms of ADHD and which ones aren't. For those of you who don't know Dr. Brown, let me tell you that he is a renowned clinical psychologist who received his Ph.D. from Yale and is the director of the Brown Clinic for Attention and Related Disorders in Manhattan Beach, California, where he specializes in the assessment and the treatment of high IQ children, adolescents, and adults with ADHD and related problems. He holds an appointment at the Keck School of Medicine at the University of Southern California and is an elected fellow of the American Psychological Association. He has published over 30 peer-reviewed scientific journal articles and 5 really terrific books on ADHD that I really want to recommend to our listeners. Smart But Stuck, His Emotions and Teens in Adults with ADHD is just unique. And his newest book, Outside the Box, Rethinking ADD, ADHD in Children and Adults, A Practical Guide, is really a valuable resource for anyone who wants to understand ADHD. You can reach him at his website, brownadhdclinic.com, if you'd like to reach out to him. We would also like to thank the sponsor of today's webinar, NEBA Health. We're grateful always to our sponsors. They let us continue to give these great webinars at absolutely no cost to our listeners. NEBA Health offers the first FDA-cleared brainwave test to help clinicians determine if a child's symptoms are due to ADHD or another condition. It is only available via prescription. It is non-invasive. It takes minutes, and you need to find a NEBA provider if you're interested in following up at the website nebahealth.com. So that's NEBA, N-E-B-A, health.com for the NEBA brainwave test. So thank you, NEBA. And with that, let me turn it over to Dr. Brown.
Welcome to all of you who are signed in, and I hope this will be helpful to you. So our focus today is on the issue of how do you get an adequate evaluation for ADHD? And I think before we go any further, we need to take just a second to talk about what we're talking about what are we referring to with the term ADHD. For many, many decades, this disorder has been thought of as essentially a disruptive behavior disorder of childhood. Little kids, mostly boys, who couldn't sit still, wouldn't shut up, and were driving everybody nuts. It wasn't until 1980 that they introduced the term attention deficit into the name of the disorder and began to recognize that there are many people who have ADHD who have no significant behavior problems, and that even for those who do have behavior problems, the bigger part of the difficulty is not usually that, but rather the attention problems. And what we've learned over recent research that's been done over the last decade or so is that the attention really includes a much wider range of functions than just listening to somebody when they're talking to you. And it really involves a range of functions which we speak of as the executive functions, the self-management system of the brain. And it's a developmental impairment. There are other ways in which executive functions can get impaired if you have a head injury or a disease process going. But this is a developmental one, meaning that it just is not unfolding in the way you would expect for somebody of the particular age you're looking at. Now, there are other places in which I've talked about the nature of executive function, and I've certainly published stuff on it, which you can check out on my website or on the Attitude website. But let me get right into the question of how we go about getting an adequate evaluation for ADHD, what's needed and what is not needed. The first thing is to get a person, and usually it would be a licensed medical or mental health professional who's experienced an understanding of ADHD in students of whatever the age is that you're interested in getting the evaluation for. Now, that might be a pediatrician, or particularly a developmental pediatrician. It might be a psychologist. It might be a psychiatrist. It might be a family practice doctor. But the thing you need to know is that most physicians and most psychologists have had very little training in the course of medical school or graduate school, and even in their professional training, to really get into the depth of what ADHD is as we now understand it. And so it's important to ask questions about this, what sort of experience they have and to what extent they specialize in it. Because what you need is somebody who really understands what ADHD is and what it isn't. And also who knows what other medical or emotional or behavioral problems might be causing symptoms that look like ADD when it's not ADHD, or that may be accompanying and complicating that ADHD. And for that, you need to ask around. You can consult your pediatrician. You can check with the CHAD group. They've got a website. The National CHAD Organization has a website which lists professionals in each of the states, so it's separate listings. Or you can talk with people active in CHAD who have experience in getting somebody that they found helpful, or also warning you about people who've not been particularly helpful for getting an evaluation. So I'd like to start out by just telling you what I think needs to be included in an adequate evaluation for ADHD. The most important element is a clinical interview with the student and at least one parent, if possible, both parents, or somebody else who's an important caregiver for them, somebody who really knows the kid. And by clinical interview, all I mean is a conversation which looks into sort of what the problems seem to be and the background. I'll talk more about those details and what goes into a clinical interview later. But the idea is it's a conversation. Asking questions, and there's a sort of a semi-structured way, not just chatting about your life history alone, but try to get to the details. And then a normed ADHD rating scale. Now, there are a number of those out there. There's one by Russell Barkley. There's one by Keith Connors. I've published some. There's another one called The Brief. There's another one called the BASC, B-A-S-C. Those are a number of the popular types of norms. Norm simply means that they've administered the scale to a sample of children of various ages, and it'll tell you what the age range is. So you're comparing what you say about your son or daughter and what he or she says about himself or herself. And then you want to get some reports from what teachers are telling you, because they see a lot of kids of the same age. There should be a review of the DSM-5 symptoms of ADHD. I'll talk about what that includes in a minute. And then certainly to consider what other things might be going on here that could be explaining the difficulties. And then I think it's really important to have that evaluation include the clinician who's helping you with it to tell you a little bit about how we understand ADHD and what the options for treatment are, what seems to work, what doesn't work so well. And then, of course, you'd expect the clinician to put the pieces together and offer some recommendations about, does this really look like ADHD, or does it look like something else, or does it look like a combination of ADHD and one or more other things? But now, before we go any further, I want to take a few minutes to talk about what is not something that's required. And the first thing is neuropsychological tests. Sometimes schools and other doctors are recommending that, well, if you really want to find out if a person has ADHD, you have to get them a neuropsychological test, which is a battery of tests that are called a test of executive function, which seems to fit with what we're talking about with ADHD. But the problem is those are tests, most of which were developed back in the 1940s and 50s for studying people who are schizophrenic or who had serious brain injuries. The test can be helpful for somebody where they've had a traumatic brain injury, or we're looking at damage from strokes or from Alzheimer's dementia. But the fact is, it's a bunch of tests which psychologists who are specifically trained to do these tests administer individually in an office, arrange these cards, put these blocks together, draw lines and arrows. And the fact is, from that, neuropsychologists try to talk about how proficient a person is relative to people of the same age with these various neuropsychological tests. However, The American Academy of Child and Adolescent Psychiatry, years ago, when they put out their standards for what you need to include in evaluation, specifically says those are not needed for doing an evaluation for ADHD. And what's the reason for that? Well, the reason it hits a lot of people is they can cost anywhere from $2,000 to $5,000. And it takes a lot of time and a lot of money to do them. But the more important thing is these tests do not provide significant information about how the person functions in the variety of tasks and situations that they face in school or in interpersonal relationships or in dealing with their families. And in order to get that, you need to ask a lot of questions and get some information. The tests are sort of tracking specific skills in an office in a particular period of time, which does not generalize. There are people who can pass the IQ tests and the various other achievement tests that are used and the executive function tests that neuropsychology uses and do very well in them and still not be able to function well with those things that are problematic in ADHD. A full battery of neuropsychological testing is not required and often is not even helpful for the assessment of ADHD. Second, there are some doctors who ask people to get their brains scanned in order to be able to see if they have ADHD. And one of the scans that's used sometimes is a SPECT scan, which is sort of like, it's got like a fancy X-ray of the brain. It's not really an X-ray, but it's a scan where you get a very brief look at the structure of the brain. But the problem with that is, the problem with ADHD is not a problem with brain structure. It's not as though there are pieces missing in the brain. It's not as though the sort of thing you can look at to see, is there a tumor there? There is no tumor there. That's not part of ADHD. And it's not like there's something broken, like you can see a broken arm. What those images show you is they're very valuable for research, and they're kinds of tests that we can do with brain imaging research to understand more about what's happening for people who have ADHD. But we do not have at this time, and I don't foresee it any time in the near future, norms that allow us to say, okay, well, how does this look compared to the brain of somebody else? And there's a good reason for that, because ADHD is not about something that's static and structural in the brain. It's about communication within the networks of the brain, which are very fast. We're talking about fractions of a second, and that are involved in the brain's communication, one part with the other. It's not a structural problem, and therefore the brain imaging tests are not going to be able to pick it up. There's no need to spend money on doing that for that purpose, not to identify ADHD. And there are a number of other tests that are computerized that purport to assess ADHD. Some of them are named like tests of variables of attention, the Connors CPT for most kids and for preschoolers, integrated variables of attention, and there are a number of others. And the thing with those tests is basically they're boredom tests. When a person is asked to sit in front of a computer, look at the screen, and then they keep rapidly changing the images on the screen, and you're supposed to hit the button if a certain image appears and not hit the button if another image doesn't appears. And the fact is that they don't very often say somebody probably has ADHD if they don't, but they often give false negatives, which means that a kid can do that and play the game very well on the computer, which runs 15, 20 minutes typically. And the computer says, well, no, this person doesn't show those patterns that are characteristic of ADHD, when in fact the person may have serious difficulties with ADHD that just don't show up, particularly kids who are really good at playing video games. So I'm suggesting to you that computerized tests are not required for assessment of ADHD, and they're generally not even all that useful. Brain imaging studies are not required for assessment of ADHD. They're not even picking up the process of things that are going on because it's not a structural problem primarily. And the battery of neuropsychological tests is not. Those are not things that need to be included in an evaluation. If we're looking at the clinical interview, what should that include? It should include some conversation about what school or home or social problems have brought the patient for evaluation now. Why are we hearing about it now? Is there something going on? And how do these really impair? How do they mess up the person's functioning in daily life? And then you need to look a little bit at the context. Who's in the family? Who lives in the house? And who's interacting with the kid? And how are those relationships going? And then you certainly want to get some picture of how are things going in school and at home and with friends and family relationships. Where are the problems? In what way is this boy or girl, young man or young woman, having difficulties that are more than the difficulties you'd expect for somebody of their age? And then you want to find out something about not only the problems of the individual, but also their strengths, because that's important. And also what stressors. Are there some things going on? Is there a family member who's sick or incapacitated or who's recently died? Are there special stresses about, is the family moving? Has the family relocated recently? You want to get the context of what's going on and also the day-to-day picture of where are the problems that people are thinking, yeah, that might be an ADD problem. There's more. In that evaluation, there should also be some attention on current or past developmental and physical development of physical health. Is this a kid who has struggled all along in terms of being able to read, or in terms of being able to move around? Were they slow to be able to develop their language? Are they taking any medicines? They're supposed to help ADHD or doing other things that might have side effects. You want to get a picture of their pattern of growth. Is it a kid who's growing faster than most of the peers? Or is it a kid who seems to be a little slow to be hitting their usual growth marks? How are they doing on eating and sleeping? Those things can make a huge difference. And then there's a fishing expedition, because we know that ADHD is highly heritable. Out of every 4 people diagnosed with ADHD, one of them has a mom or dad who's got it, whether they know it or not, because in the old days they were never any good at diagnosing it, and even today it's missed a lot because a lot of clinicians are not familiar with how we understand ADHD these days. And so what we do is ask about, is there anybody in the family, either living or dead, who's had symptoms like this, who's had a lot of trouble paying attention or with learning certain things, maybe good in reading, not so hot in math, or vice versa? Are there behavior problems? Are there difficulties with a lot of anxiety, more than most kids have? Does the kid seem to be depressed? Are there social problems, social interaction things, something that might be on the autism spectrum? Is there OCD, which would be the kind of kid who's overly perfectionistic and everything has to be just so? Is this a kid who's smoking a lot of weed or doing a lot of drinking, particularly with the adolescents? The incidence of drug and alcohol abuse is double what it is among those kids with ADHD compared to those who don't. So you need to get that background, because it's not, if you think about, out of every 4 people who have ADD, one of them is going to have a mom or dad who's got it. And if the parent is not a person who's had ADHD, it's very likely there's going to be a grandparent or an uncle or an aunt or a cousin or a brother or sister. So that gives us a little more idea of what else might be in the gene pool for this particular person. Then you want to look at the very practical things. Let's take a look at the report cards, and if there have been any evaluations in the past or currently done by the school, or psychological evaluations, IQ tests, things like that, they can give you some idea of where the strengths and the difficulties seem to be turning up. Some of the children that are presented for, and older students who are presented for ADHD problems may already have a 504 plan or an individualized education program. Maybe they've been getting some accommodations, like extended time for testing. It's not that every person with ADHD needs it, because some of the problems, they go too fast, not too slow. They've been getting some tutoring that helps to understand better what the issues might be. And then the administration of that normed ADHD rating scale. And if the child is 8 years old or older, well, you want to get the report from them on one of those scales, because the list typically will have anywhere from 30 to 50 different items. Do you have trouble with this? Do you have trouble with that? And then the parent reports, and you like to get the teacher reports, but you want to be sure you're using a normed scale that's age appropriate for the person that you're looking at. Now, I'd like to mention 2 things about ADHD generally that I think are really important to take into account when you're thinking about symptoms of ADHD. What you need to have in mind is that all the characteristics of ADHD are problems everybody has sometimes. It's just that people with ADD have a lot more trouble with it. It's chronic, and it's given them a lot of trouble. So in that sense, ADHD is not an all-or-nothing deal like pregnancy, where you are pregnant or you're not pregnant, and there's nothing in between. It's more like depression, where everybody gets bummed out once in a while. Just because somebody is unhappy for a couple of days does not mean we're going to diagnose them as clinically depressed. It's only when those depressive symptoms are persistent and making a lot of trouble for me, say, yeah, that's a depression, we should do something about it. The more problematic piece of this that really interferes sometimes with evaluations is what I call the situational variability of ADHD. And what I mean by that is quite simple. I've seen thousands of children, teenagers, and adults with ADHD. Every single one of them has a few specific activities and tasks in which they have absolutely no difficulty in utilizing those executive functions where they have so much trouble with them on almost everything else they do. Now, sometimes they're very good at focusing when they're playing a sport that they're interested in, or maybe playing video games, or maybe making things with wood or mechanical tasks, or maybe making art, or maybe doing music. There are a wide variety of these things. Sometimes it's a little kid with Legos. When they're small, they can build amazing stuff with Legos, and then they get older and they're taking car engines apart and putting them back together. Sometimes they're just very proficient athletes or artists or musicians. But the point is, everybody I've ever seen who has ADD has a few things like that where they can exercise their ability to manage and focus all the characteristics that are part of ADHD quite well. It's not impairing them, even though they have a lot of difficulty with those same functions, those executive functions, in almost everything else they do. And the problem with that is there are some people who do not understand that about ADHD and will say, I've had, for example, people come bring their kids into me and they've said, the doctor said, well, can your son or your daughter focus on a TV show for 30 minutes without having to get up? And you say, well, yeah, depends on what the show is. And they say, oh, no, they can't have ADHD then because then this is something where it's hard for them to concentrate. Well, that's plainly wrong. All the people I've seen with ADHD have a few things where they can concentrate. If you ask them about it, why is it you can pay attention for this and not for that? Why can you focus on this, or why will you work on this but not on that? Usually what they'll say, it's easy. If I'm interested in it. Or if I feel like I've got a gun to my head and that something I think of as very unpleasant is going to happen very fast if I don't take care of this right here, right now. Under those two conditions, no problem. But under those two conditions, it changes the chemistry of the brain instantly. And the problem is, it is not under voluntary control. So the exception, the situational variability of the ADHD symptoms is part of the picture for everybody. The question is, in most of the things they need to do, in what ways may they be impaired? Okay, now the DSM-5, which is the Diagnostic Manual the Psychiatry Association puts out, and this is the 5th edition of it, tells us there are 9 symptoms of inattention that they call attention to, and they're asking about not the whole life, but within the last 6 months. Is the person often, and I've underscored that and put it in bold type because it's not does it ever happen, it's does it often happen more than what is typical for the age. And this includes difficulty in paying attention to details, making a lot of careless mistakes, difficulty maintaining focus on something you need to focus on, and then I would add shifting focus when you need to and not just staying stuck on it. Having problems with seeming like they're not listening when you're talking to them, and so their mind is just elsewhere. Having a lot of trouble following through on instructions or tasks when they ought to be able to, at this particular age, understand and be able to do it. Difficulty getting organized. Now, partly that may be organizing stuff, like what's in the backpack, what's in their desk, in their room. But some of it is organizing activities, like when you've got a bunch of stuff to do, can you figure out, okay, what needs to be done first and what needs to be put off until later? And is this somebody who is having trouble in sustaining mental effort? If they have a longer thing to read or a longer thing to write, can they keep up the effort to work on those longer tasks? Or is it something they can only just give passing attention to it? There are 3 more. often losing things. Now, many kids lose stuff, but the question is, do they seem to lose stuff that's necessary for them a lot more often than most kids do? Are they easily distracted? All of us get distracted sometimes by things that are going on around us, and sometimes by things that are going on in our own heads. But is this person getting distracted way more than most others? And are they just generally forgetful in daily activities? But keep in mind, the memory problems with ADHD are not primarily with long-term storage memory. They're usually with short-term working memory. It's being able to hold on to what's happened just a few minutes ago, what they just were told, what they were about to say, what they were about to do, and they sort of lose track of it. They just space out on it. And many of them are really quite good with their long-term memory. So those are the 9 impairments listed for inattention. And if you're going to make a diagnosis of ADHD according to the DSM-5, the kid ought to have at least 6 of the 9 where they're having significant trouble. And if they're 17 years or older, then they only need 5 of them. But there's one more set of symptoms, and those are the hyperimpulsive symptoms. And remember, you don't have to have some in each of the 2 categories. Having the appropriate number, 6 or 5, in either one of these sets of symptoms is quite ample for being able to make a diagnosis if you see the impairment. And with the hyperimpulsive stuff, it means, is this somebody who fidgets a lot more than most people of the same age, or is constantly tapping things or jiggling their feet or squirming around? Do they seem antsy? Do they have a hard time keeping their butt on the chair when they're expected to sit down for a while? Now remember, if we're looking at a preschooler, you do not expect that kid to be able to sit for very long. That's why they don't put them in desks usually. Are they running around and climbing when they're really not supposed to? Are they often or always making way too much noise when they're playing? Does it seem like they're always on the go? It's very hard. They've got 2 speeds, full speed ahead or asleep. Do they talk so much that, people may not say it, but they feel like saying, shut up for God's sake, let somebody else talk once in a while. And remember, we're comparing with other kids the same age. Do they blurt out answers to questions before you start asking them a question and they're giving you the answer, assuming that they know what you're asking about? And they may be right, they may not, but they don't even let you finish. Do they have trouble waiting turn? Like you're stuck in a long checkout line at the grocery store. You have to wait a long time for service in a restaurant or store. Does it drive them nuts more than most other kids of the same age? Are they constantly interrupting other people? Not just once in a while, but this is a big thing for them. And again, if you've got 6 of these 9, that's enough to say, well, this is the hyperactive impulsive type of symptoms. If they've got 6 of 9 of both of the 2 categories, that's the combined type. If they have only 6 of the 9 inattention symptoms, that's predominantly inattentive type. And it's, again, 5 of either of these for somebody 17 or beyond. But we also want to get information not just from the parents, but also to find out what the teachers see. Now, there are some teachers who miss it because there's some kids who don't demonstrate their difficulties much in school. There's some kids who would manage to behave very well in school, and yet when it comes to being at home and doing homework and stuff, they have a lot more difficulty. And then there's some where behave very well at home, and they are not able to meet expectations at school. And so you want to get some reports from teachers. Now, these are particularly valuable if you're dealing with a kid who's in a class where there's one teacher there most of the day with them, because that teacher's got a much better view of what's going on socially and academically. And they can give you more details, although some teachers are very cautious about saying anything that looks like it might be critical to the kid. The parents might get back at them. The teachers for junior high and high school, usually where you've got multiple teachers, those reports are more variable because it's going to vary according to subject matter, and the teachers usually see maybe 5 classes of kids a day, and they're not going to know as much as the teachers who are seeing the kid all day. You might want to take a look at standardized test scores. There's some kids who do very well on standardized tests and have a lot of difficulty in functioning well day-to-day in classwork. And then there's some others who do very good classwork, and then they get really jammed up when they're taking standardized tests. Take a look and see what their strengths and difficulties are. Homework completion is a big thing. Now, are they able to get their homework done, and how much help do they need with that? And can they remember to keep track of what they're supposed to be doing as they get older enough that that's important? And then the other thing is when they're taking tests, do they have enough time? It is not true that every person with ADD needs extended time for testing. The problem, as I mentioned earlier, is that sometimes people with ADD try to work too fast. It's as though the prize is going to go, the highest grade is to the person who finishes first, which obviously is not the way it works. But there are many who have to go back and reread things because they can't keep in mind what they just read, or who need to go back and double-check their math because they make a lot of careless mistakes. You want to get that school information as part of an adequate evaluation. And that's important also for the clinician to ask them questions about other possible co-occurring medical or learning disorders. The incidence, let me just give you a simple example. The incidence of anxiety disorders in kids in the general population is about 5%, depending on how you measure it. The incidence of anxiety disorders among kids with ADHD is about 35%. And that's true pretty much across the board for other kinds of like depression. The incidence of substance use disorders, show me a kid 10 years old, carefully diagnosed with ADHD. I can tell you that kid statistically has double the risk of having a drug or alcohol problem at some point in his or her life that'll rise to the level of diagnosis if they're not treated with medicine. That's a very vulnerable group. And you want to get information from teachers if they think there's a specific problem where they're getting hung up in reading or hung up in math or in written expression. Let me just show you one. This is not yesterday morning data, but it's something that's, I think, still quite true. This is a sample of kids seen in a clinic for ADHD, and it's how many kids have various types of learning problems that we would think of as a specific learning disorder. Reading, often referred to as dyslexia, the base rate in the general population is someplace around 5-7%. And in this clinical sample is 27%. In math, difficulty in doing computations and just basic math relative to the age group, about a third of them. And look at this one, written expression, which is it's not penmanship. We're talking now about getting ideas out of your head and into sentences and paragraphs. Almost 2/3 of the kids with ADHD in that clinic sample had significant problems with being able to get their ideas out. Sometimes it's just a tedious process. They may have good ideas about what to write, but it takes them a very long time to get it out. Or it may be that they just have a sort of a writer's block. But the vast majority of kids with ADD have at least one specific learning problem that really is giving them more trouble than others. And if there's evidence of that, then there may be some need for more standardized testing individually to check out reading, writing, and math skills, or speed of processing, or possibly an IQ test. But those things are not, don't need all that testing just to determine does the person have ADHD or not. You may need some testing of that sort to address specific learning disabilities. And about half of kids have that. And this would include reading disorder, being able to recognize and sound out words. But it's not just that. It's also about being able to comprehend what you're reading. And, things like processing speed and working memory are critical for that. Math disorder, being able to understand numbers and how to work with them, and to be able to keep in mind as you go through the process of trying to solve problems. And then, of course, this issue of expression, written expression, chronic problems in what to write, organizing ideas, and elaborating. Some kids with ADHD are too stingy in terms of telling more about what their thoughts are they're trying to get out. And remember, oral expression, being able to talk it, might be very strong, and the person might still have a lot of difficulty in being able to write it. It used to be they thought about ADHD and learning disorders were absolutely separate things. That ADHD is a chemical problem in the brain. You fix it with medicine. Learning disorders are hardwired in, and you just need special education. And what we now know is those things overlap a lot, both genetically and also in terms of functions like working memory. And so it's important to take a look at both. So I'm proposing that if a student's having struggles in specific subject areas, that it's useful to ask the school to do evaluations. Typically, they'll use like a Woodcock-Johnson, now in Volume 4, or the Wechsler Individual Achievement Test, which is now in Volume 3. And those are tests of reading, writing, and math skills that give individualized assessments of where strengths and difficulties are. For kids in ninth grade and up, often we'll use the Nelson-Denny reading test, which is one where you have a standard time to answer 80 vocabulary questions and 38 questions about 7 different reading passages within the standard time. And then if the person's not finished with those tasks in standard time, they're allowed some extra time. And so you can see, does giving extra time help this person, or do they not even need it? Accommodations is where a person needs extra help. It might be accommodations of just getting the kids seated close to where the teacher teaches. It may be accommodation of extended time for taking tests. And it may be that they need some more specialized help and special education services. For that, you need the diagnostic clinical interview, and then you're probably going to need to ask the school to do like a story memory test and an IQ test. WISC-5 is one that's used frequently for kids from 6 up to 15 or 16. And then from 16 and up, it's the Wexler Adult Intelligence Scale, but there also are several other IQ tests and achievement tests available, like the Woodcock-Johnson and the Wyatt and the Nelson-Denny. But those are things which are add-on. That's not specific to ADHD. It's looking at academic problems that may be problems. And basically the questions that we're trying to ask in an ADHD evaluation is, does this person currently suffer from ADHD syndrome, the problems that I just talked about in the DSM, in ways that are impairing their function in daily life to a degree that it makes sense to treat it? And then the other question with that is, are these symptoms substantially caused by developmental impairments of executive function rather than that the person's not getting enough sleep at night or that they're in too much stress in their family or in their neighborhood or in other ways that might need to be addressed in a different way? And the other thing I think is important is that we're talking here mainly about the assessments which would be used for diagnosis, but I think it's really important not just to do an initial assessment to establish a diagnosis and then teach the patient and the family about what ADHD is and what other factors are involved in it, but also to every once in a while take a look at how a person's doing. Because sometimes things are getting better, sometimes parts of it may be getting worse. And correct if we've got some adverse effects from medication or from other treatments, and watch for emerging comorbidities, problems that were part of it but may not have been obvious earlier. Ongoing assessment is important as well. So this is, again, the slide that I used at the beginning. What is needed for an adequate ADHD evaluation? I'm suggesting a clinical interview of the student and parents, normed ADHD rating scales appropriate to the age, a review of teacher reports and report cards, a review of those DSM-5 symptoms, looking at the possibility there may be some co-occurring problems like a learning disability or anxiety or depressive problems, getting information about what ADHD is and what it isn't, and about the treatment options, what you can expect from them, and then trying to put the pieces together with the help of the clinician you're asking to help with the evaluation. So that is the basic framework of what I'm offering, and I'm very happy now to respond to questions or comments if anybody has some to offer.
Dr. Brown, would you suggest any different approach for diagnosing adults? We have a number of listeners who are wondering about.
Actually, I'm glad that question was asked. And basically, the procedure is pretty much the same for adults.
Okay.
I think it's always a good idea, whether we're talking about like a college student or an adult who may be 30, 40, 50 years old, to have somebody else there with them. I don't require that in the sense of I won't see you unless you've got somebody with you, but it certainly is a big help if you can get somebody else who knows you pretty well. It may be a partner, it may be just a friend, who can come in and offer an additional perspective on where the difficulties are. There are normed forms, rating scales for adults, and less often do we need the testing for learning disabilities. But there are times when I've had people come in who are college students or who even are graduate students or people who got their degrees but need some accommodations where sometimes you've got to do some of that sort of thing. But the basic requirements of sort of asking about those various things I included in clinical interview, those are the things that I want to do when I'm talking with adults as well as with kids.
Okay. A number of people are asking about the distinction between executive function disorder and ADHD. Are they the same thing? Is it difficult to determine whether your child is executive function disorder or has some form of ADHD?
Okay, well, that's a question I think a lot of people have. And the way I think about it, now some people would disagree with me. ADHD is basically defined in terms of the diagnostic manual by those symptoms that I listed from DSM-5. And that is the way that manual describes what makes up ADHD. However, many of us who work in the field and are specialists in this area believe that the DSM-5, which does not make any mention about executive function as part of ADHD, is behind the times. It's not caught up with the science. Mm-hmm. And so I would say, I think we can write an equation that says ADHD equals developmental impairment of executive functions. And I underscore the developmental part of it, recognizing there are other ways executive functions can get impaired if you have a stroke or a head injury or something like that. But they're just not unfolding the way you'd expect them to. So I would say they both mean the same thing, but if you want to be technical about it, the official definition that's used, for example, for insurance purposes, is the ADHD as defined by the DSM-5, and there's the ICD-10, which is used outside the United States, although they're trying to get these things overlapped so that we can use the ICD-10 numbers now for it, but. In that case, you've got to, look at the numbers and the symptoms as defined by the DSM. However, as I said, I think it's much clearer to see that this is really essentially a disorder of executive function.
Okay. We've been hearing from a number of our experts recently that they feel that there are some other symptoms that are omitted from the DSM, specifically emotional dysregulation.
Yeah,
and
well,
also
I've written a whole book about that. That Smart But Stuck book is basically arguing that the DSM criteria for ADHD ought to include problems with emotional management,
right,
and expression. And gave a lot of case studies to illustrate how that works. I completely agree that is a very important part of ADHD impairment for most people who have ADHD. I also recognize the DSM is not caught up with it. That's a book that's put together by a committee. They do what they can, and they have to do some research in order to support what they're doing. And many of us were disappointed when the DSM-5 came out that they did not address that issue. Russ Barkley and I have both written about the importance of that, among others. And that's it.
On the subject of IQ, I know you've done a fair amount of work with high IQ people with ADHD, and there are some questions about whether high IQ can mask the symptoms or it makes a diagnosis more difficult.
Well, it does. I'll tell you, one of the reasons I got interested in patients who have high IQ is that I found that many times they were being neglected and missed, because many people will say, oh, if you're that smart, you're so smart, you can't have any problems like that. It's just laziness, or you're just bored. Mm-hmm. And I'm certainly willing to believe that there are times when kids' inattention and anybody's inattention can be due to boring situations, and God knows there are certainly a lot of boring situations that we all have to put up with. But the fact is, and I've seen a lot of high IQ folks with ADHD, and I can tell you that the history for many of them includes that they were very good students in elementary school, mm-hmm. Some of them honor students. Sometimes things get a little bit shaky in middle school once they make that critical move from having one teacher most of the day who's providing a lot of executive structure for them and have to deal now with 4 or 5 teachers at a time. And then things get even more shaky, at least with 1 or 2 subjects when they get into high school. But there are some parents who are so good at providing structure and a kind of scaffolding for their kids, reminding them what they need to do, helping to keep track of assignments, and checking on the portal that the school may have for what homework is in and what is not yet in, although teachers don't always keep that up to date. And some parents, you don't see the problem even until they move out of the family home. If they're going away to college or university, where then they crash and burn sometimes because they're so used to having other people, their parents particularly, organize and structure them, that you don't see the problem until they have to manage for themselves.
Right.
So it's very common for high IQ folks to be neglected, or people don't believe them when they say, hey, I think I may have ADHD. They think they're just trying to get a leg up, when in fact they can be stuck just as much as anybody else with ADHD executive function impairments.
For those who asked me to repeat the name of the book, it's by Dr. Brown. It's really a terrific book. It's called Smart But Stuck. It's about young adults with ADHD who have high IQs, and has really interesting case studies. I found it extremely helpful. So Smart But Stuck. What are the issues with diagnosing children at a very young age? Can a 6-year-old, a 5-year-old, a 4-year-old really be diagnosed with ADHD?
Yeah, they can, but usually the problems there are executive functions. Let me back up a minute and say executive functions are among the slowest parts of the brain to develop. And nobody's executive function is fully intact usually until they're about 18, 20, 22, something like that. And hopefully we're all improving them as we go along. The kids that show up in my clinic at ages 2, 3, 4, 5, 6 tend to be kids where the problems are mainly safety related. That these are kids who often are extremely impulsive and restless. Many of them have difficulty getting to sleep at night, and often will be waking up everybody else in the house when they're trying to get to sleep. Many of them are kids who will jump off high places without realizing that they could end up hurting themselves seriously. They're the kids that when you get out of the car in the parking lot at the grocery store, you've got to hold their wrist tight, because otherwise they're going to get loose and they can be running in between cars and get seriously injured.
Right.
These are kids who tend to be hyperactive, impulsive, and sometimes they're parenting skills that parents need some more help with in order to deal with it, particularly if they're first-time parents. But sometimes there are just some kids who are wired in a way that they're very hyperactive, very impulsive compared to other 2, 3, 4, and 5-year-olds, even though those are ages where you have to be prepared for it. And the federal government actually funded a study called the PATS study, Preschool Attention Treatment Study, where they gathered together a bunch of young kids in the 2 to 6-year-old range and assessed them and found they had significant problems. They tried to do parent training for about a dozen sessions before they did anything with medicine, and they tried medicine. And they found that the medicines work reasonably well for those young kids. Often you get a little more side effects, and the other part of the problem is that they were not quite aggressive enough with the dosing. Because the stimulant medicines do not go by, the effectiveness doesn't go by how old you are, how much you weigh, or how severe the symptoms are. It's how sensitive is your body to it. And some people, you've got to be very careful and start with a very baby-sized dose, and that'll be fine. And then there are others where, even with some young kids, you've got to go up a lot higher than normally would be recommended because their bodies are not that sensitive to it.
Right.
So the answer is yes. You'll find kids in the 2 to 6-year-old range who do need that help, but these are kids who often are coming in because their behavior management problems and their safety issues.
Right. Okay. So a couple of people are wondering about slow processing speed. So is slow processing speed a separate issue? So can slow processing speed exist without being ADHD? Can it make it appear?
Well, it can, but usually if you see it, ADHD is a syndrome. It's a cluster of problems that tend to hang together. And slow processing speed is one of them. It's not noted in the DSM criteria any more than the emotional problems are. But we found that particularly we've published a couple of papers. Incidentally, And if anybody's interested, they can go to my website, which you mentioned earlier, brownadhdclinic.com, and there are copies of some of the papers that we've published about these things. But we have published on the problems with working memory and processing speed being particularly vulnerable. Those are just categories of responses on IQ tests. But the fact is they refer to like how quickly people are able to process information. And the fact is, for example, that there are some kids with ADHD. If the teacher says, "Okay, copy these 4 sentences off the whiteboard or the blackboard," that they'll be way behind in terms of being able to copy that information down. It's just slow processing. If you ask them to write sentences or paragraphs, there's some people who have really good ideas about what to write, but it takes them half a forever to get the sentences and paragraphs out on the page. And often that is a processing problem. It also can be connected to working memory, being able to hold one thing in mind while doing something else. And that really messes up reading. For example, if you can't remember what you just read in the first part of the paragraph by the time you get to the end of the paragraph.
Right.
Those are 2 categories that are not listed in the DSM criteria that need to be looked at when people are struggling with this kind of thing.
Okay. Question about the diagnosis of girls and women. We know, and we've heard, we've written a lot about the fact that women and girls tend to be diagnosed with depression or with other disorders when their inattentive ADHD is missed. Is that your experience? And do you think that's specific to the inattentive quality of ADHD?
Well, I think there are some girls who can be just as disruptive and have as much behavior difficulties as boys do, but they're rare. Mm-hmm. The incidence, back in the day, they used to say there's 6 boys for every 1 girl diagnosed with ADHD, and then that was just counting kids dragged into child guidance clinics. And then it went to 3 to 1 when they were doing epidemiological studies. Now it's about 2.5. But the interesting thing is, in adult clinics, what we find is that it's much more like 1 to 1, equal number of males and females. And what that tells you is there are a lot of girls and women out there who have these difficulties who are not being picked up as having them until they get old enough to represent themselves and get into clinic and seek assistance. And I think the main explanation of that is that the girls usually they're not making that much trouble for their parents and their kids and their teachers as some of the boys are.
Right.
And it's often the hyper kids who get noticed first on ADHD.
And then we've also heard that the girl who waits till the last minute will stay up all night and get the paper written at great personal cost, but as opposed to just blowing it off or whatever. So
that happens with some guys too. But it certainly is. That sometimes those difficulties are harder to recognize. But if you've got a girl who's struggling and being able to manage her workload and in being able to work to her ability, it's important to ask the question of, is this possibly related to ADHD? And it may be that, or maybe there's something else.
Right. Okay. So one of the things that we find at Attitude, and there's some questions about this, is that a number of our readers come to this site or come to Attitude when their children are diagnosed with ADHD. But as time goes on, it becomes clear that they're actually have autism spectrum disorder or some combination of the two. What are the special issues inherent in differentiating ADHD and ASD in children? And
that's a subject I've become quite interested in recently. In fact, I'm currently working on a book on that topic.
I think it's fascinating. I really do.
The autism spectrum includes a wide variety of difficulties that kids have that are characterized by their ability to connect with other people. Mm-hmm. And to be aware of social expectations is really severely impaired compared to others of the same age. And the fact is that among those who are diagnosed as having ADHD or having autism spectrum, the vast majority of them also have ADHD. And
Right.
so sometimes the ADHD is recognized and the autism spectrum isn't, and sometimes it's the opposite. There's a big problem, though, with the way the United States reports this. We've had reports of increasing incidence and prevalence of autism spectrum disorder over recent years, and they now say it's 1 out of every 59 kids. But the thing that they don't tell you is that they're picking this up based on kids who are 8 years old or younger. They do not report the diagnosis for anybody older. And the fact is, more than half of those diagnosed by 8 years old are intellectually disabled. And you got about 45% who are average or sometimes way above average. Some of them are really smart, who are just not getting picked up with that. And those kids are really vulnerable. And it's important, I think, for us to do a much better job than we are now, at identifying them, because the higher functioning, the smarter kids who are on the spectrum do not get diagnosed and recognized often until much older. There's a lot of research which is beginning to emerge on this, and they don't get adequately diagnosed, and they're very vulnerable to depression, to social isolation. And there was a study that was just published in the UK recently that among higher functioning individuals with ADHD, the rate of completed suicides is 9 times that of the general population. These people suffer, but they do not get identified and they do not get help. And we do very little to train doctors and educators about how to recognize and how to provide support for these kids, where you've got an overlap between the ADHD and autism spectrum. People who just have they may be brilliant. Many of the ones I see, many of them are well above average in their smarts, but they just are clueless in terms of being able to understand how other people are thinking, and their social radar in terms of knowing when to shut up and when to speak. And they'll say things that are insulting or hurtful to other people without even realizing it. And if you question them about it, they'll say, "Well, I'm just telling the truth."
Right.
And there's not that ability to, and those are skills that are taught. It's easier to explain to a 7 or 8 year old how to factor a quadratic equation than it is to explain why a joke is funny in one situation and not in another. So this whole area of autism spectrum is one that I think needs much more attention, both in terms of identifying particularly the higher functioning people and in providing training for physicians and psychologists and educators to provide better structure and support for these kids, because they are very vulnerable, particularly as they get a little bit older and have to shift for themselves much more than when they're younger and the parents can protect them.
Yeah. I mean, we're seeing that a lot at Attitude, just kids that turn out, to not be diagnosed. Are there clear, in your experience, differences in the way social difficulties play out in ADHD from an autism spectrum disorder?
Well, it's hard to disentangle, because I would say that at least 2/3 of the people who have autism spectrum, particularly those who are average or above average, also have ADHD. And, there are several studies that have been published on this. And so the ADHD still looks the same for most of them, although sometimes it's a little harder to get the details from them about what's going on. But what's different is that with these kids, you also have the social cluelessness,
right,
and the inability to appreciate that other people have different ways of seeing the same situation you're looking at that may be equally valid. And most clinicians are not, even the tools that they give us to assess for autism spectrum are very good if you're looking at some of the most severely impaired. They're not that good for assessing people who are higher functioning, but the problem is those people are having to function out in school, in mainstream school usually, and in mainstream universities and in social world of employment. And often that's the stuff that really hits them, as they are expected to be more independent, and they're not able to read the signals with other people, regardless of how smart they are.
So I'm afraid we're out of time. This is such a fascinating topic. I really want to thank you, Dr. Brown, for not only this hour, but also all the work that you do. And can you repeat the URL of your website? I'd like to make sure everyone has that down.
Yeah, it's Brown, just like the color, brownadhdclinic.com.
That's great.
And I thank you very much for the opportunity to do this, Susan, and I thank everybody who's listening in.
Thanks, everybody, and happy Thanksgiving.
You too. Take care.
For more Attitude Podcast and information on living well with attention deficit, visit attitudemag.com. That's ADDITUDEMAG.com.
Ever tried reading while jogging, cooking, or even juggling flaming torches? Yeah, it doesn't end well. But with audiobooks.com, you can conquer books without the circus act. Dive into over 450,000 titles, including more than 10,000 free ones. Get hooked on a bestseller, find your next obsession, or finally read that classic you've been avoiding since high school. And here's the inside scoop. Sign up today for a free 30-day trial and snag your first 3 audiobooks on the house. Sign up for your free trial at audiobooks.com/podcastfree today. That's audiobooks.com/podcastfree.